Stella is calling from Banda, and she's saying she has 2 boys, and every time they are passing out urine, they cry a lot. And their male part seems to be decreasing in size. What could it be?
Yeah, Stella, thanks for sharing your concern about your boys. Pain on passing urine is called dysuria, is of concern. That most likely means either there's some infection in the bladder or something is blocking the passage, the easy passage of the urine through the passage. So that needs to be evaluated. If these boys are young, some conditions, some boys are born with it, and either the urethra is narrowed, or that may be associated with opening of the urethra on a wrong side, and the opening is narrowed. Okay. So this is something which has to be evaluated. First, if they are young, by a pediatrician, and if the pediatrician thinks that he or she needs the consultation of a urologist. Urologists are doctors who are specialized in the urinary system, and they can give some further assistance.
Thank you so much, Dr. Stella. I think you've got a response.
He's raising his concern there is that he's having pain in her testicles, in his testicles, and this seems to be recurrent, and I think they are trying to give him antibiotics for the treatment. Well, if you get pain in your testicles and it's from infection, we call that otitis. If it recurs, it's usually advisable for you to see a urologist. Now, urologists are specialized in assessing that urinary and the genital system in this case, because they will help to evaluate. Sometimes they do extra tests. Instead of doing antibiotics all the time, I think I would advise you to see a urologist. Urologists, they are available in the country. We have, even here in Kampala, we have quite a number of doctors, urologists who are available, and they should be able to assess and give an opinion on how best this can be done. Sometimes what happens is when you get an infection, you get the channels narrowed, and now you get scarring, and that increases your risk of getting subsequent infection. And so, but that is best evaluated by the doctor. By the medic. Especially the urologist. Okay. I think for you now, you need to see a urologist. That will be the best option.
Thank you so much, Doctor. I think John Bosco, Doctor has responded to you well, and please take the advice that he has given you. Fatuma in Kawempe, what causes pain on the right lower part of the abdomen?
Right lower part?
Yes, consistent pain.
Yeah, so, well, yes. So if you have pain in the right lower abdomen, the common organs, for example, in the lady there are the ovaries, the right ovary especially, you have the right tube, but also the appendix is located in the same place. So if you have recurrent pain, those 3 have to be evaluated. And so a doctor will be able to examine you, will be able to request for a scan. When the scan is done, if it is a pain coming from the ovary, maybe because of a cyst, the cyst will appear on the scan. Okay. If it's a tube blockage or a tube having water in it with infection, the scan will also show. Okay. But if it's appendix, clinical exam and also a scan can be able to show. So you need an urgent. Some of these conditions are life-threatening. For example, appendicitis. If you have pain because of appendix infection or appendix blockage, then you need urgent treatment. So I think you need to be examined. You can either be examined by a gynecologist or you can see a surgeon. But I will recommend a gynecologist to start. Thank you so much. Yes.
Doctor, please give us your last word for all those who have been watching and listening with infertility problems.
Yeah. Yes. Well, I can advise people that first of all, thank you for listening, because knowledge is power.
True.
Yes, and my take is that infertility should really not be taken as a death sentence, because we have solution now, and these solutions are available. As we keep on going through this series, you'll get to understand that these things are possible, and we are doing them already in this country. Okay. So you should not kill yourselves. Don't separate because of infertility. Please, these things are treatable. Yes.
Thank you so much for being with us. This has been Medical Minds with me, Teacher Zita, and Dr. Andabati. From the team, please stay well.